It's not luck. I'm telling you, it's God's will. I would have never, ever come here because I live in Abington. I have
Right.
gone to 50 million eye surgeons
Right.
and tried to have this surgery done over the last 10 years at least. And was that nobody would really do it until my daughter, who is a physician, has a friend who she went to medical school with and all through grade school with, who is an ophthalmologist, who in the summer really we started talking about it because I was getting nervous about not having sight if I was stuck in a hospital as I got older or disabled, and not being able to put my contact lenses in or use my glasses, because if my glasses fell off my bedside table and onto the floor, I had to get out of bed, crawl on the floor, and find them because I could not see them. So this doctor, who was an ophthalmologist, young man, said the only person that he would send anyone to, he was a Wills Eye trained, physician, was a Dr. Lichtenstein, and gave Lauren, my daughter, the number and where the office was, and I made an appointment. And it turns out that Dr. Lichtenstein, after talking to him he didn't say he would do it right away because it's a very difficult procedure. It's a secondary implant. I had not much of a capsule left, so it was difficult for him, I'm sure. I don't know. I was asleep, whatever. I wasn't there. Dr. Lichtenstein was very caring. He answered my questions, and I had many of them. He listened to my history and really thought about the whole situation and why I wanted the surgery done and why he was going to do it. And I left feeling very confident that whatever he did was going to be okay. I'm telling you, I'm in my life, I'm an anxious person. And I honestly walked out of here in September and I said to my husband, because he was with me, and he had just had cataract surgery last year with another physician who Dr. Lichtenstein also trained. Interesting. And he, I just walked out and I said, I'm doing it. This is it. I'm doing it because I really felt comfortable and cared for. The day that I came in for surgery, I woke up, I went to bed, I woke up, I slept well, I woke up and we came. And from the beginning, they were very, caring. Pre-op, the anesthesiologist was there pretty much all the time. I had 2 nurses that were there. Started my IV, and I'm a really bad stick. Went really well. And just waiting wasn't a long wait, I felt relaxed. And then they wheeled me into the laser room, and I was really, I had never had that done or had anything like that done, and found it interesting. I saw all kinds of beautiful colors, and then they wheeled me into which I thought was probably the OR, and did the surgery. And I don't remember anything from the surgery much. I just remember vaguely talking, kind of people talking. And then when I was back in the post-op or place, I sat up and I drank my apple juice and ate my graham crackers, and the girl said, or the nurse said, that I could go home. And I thought, okay. So I stood up and I had the shield on, but the shield was slitted. I could see partly through the shield and was able to see more form than I had ever seen before, more focus. And walked out, asked if I needed sunglasses because I, for 35 years, wore sunglasses every day because I was very sensitive to light. And she said if I felt comfortable I could, and if not, it would be okay. And we went home, and in fact I went to Kohl's, I think, on the way home. And then just went home and relaxed for the rest of the day, and had no pain, no pulling or any kind of bruising feeling, nothing. I walked out of here being able to see, and I can function without a contact lens, and with sight just in the one eye. And it's very interesting also, the power that he put in complemented the power of my contact lens. So I now do not need over glasses to read or over glasses for distance, which was always something that I needed to do. I'm very appreciative now of the fact that I can see at nighttime in a bedroom. Before, if I were at home, I learned over 35 years where to find things or whatever in the dark or with no sight. But when I was somewhere else or in a motel or my daughter's house or whatever overnight, just to find the sink or the toilet paper was a real challenge. And I don't need anything anymore, and it's great. It's wonderful. I honestly also, interestingly enough, don't have the light sensitivity that I had before, and find myself not putting those sunglasses on even on a dreary day. I thank him very much for being a wonderful surgeon and for taking my case on, and that I'm indebted to him for my sight, and I'm so glad or happy that I got to be his patient.